Hello, welcome back to Change. We are glad to see you all again. Before we begin session 2, let's do a quick recap of session 1. Please take the pause between each question to provide your answer. What is cancer? Cancer is uncontrollable cell growth. What does health disparity mean? A health disparity is an inequality in health outcomes. Name 4 known causes of cancer. Some known causes of cancer include tobacco use, infection with certain viruses, radiation, and immunosuppressant medicines. Class attendance is important, so thank you for being here. Last session, we talked about cancer in general. This time, our focus is on 3 cancers: prostate, breast, and colorectal cancers. We'll start by defining prostate cancer and learning about the common types. We'll discuss risk factors that can increase the likelihood of getting prostate cancer, ways to reduce those risks, and screening and guidelines and recommendations. If any personal questions come up or something you would like to share with the Change team, please feel free to call or email us. If the Change staff does not have the answer to your question, we will talk with our team's expert medical doctor and provide you with the answer in the coming week. Now let's begin with some background knowledge. What are risk factors for disease? Risk factors are anything that increases the chances of getting a disease. Having a risk factor does not mean you will get the disease. Some risk factors can be changed and others cannot. Making adjustments to modifiable risk factors can lower your risk of developing certain diseases. Now, before we dive in, let's go over some terms. Cancer prevalence is the total number of individuals who have a disease over a specific period. Cancer incidence is the number of new cases of a condition. In 2019, there were an estimated 50,450 cancer cases diagnosed in Georgia. That's 138 cases per day. For every 100,000 person in the state of Georgia, there were 126 new breast cancer cases diagnosed from 2013 to 2017. On the next page, you should see a table with prostate cancer facts and figures. The estimated new cases are incidences. Last year, prostate cancer had 248,530 new cases, and the year before, 191,930 new incidences of the disease were reported. Prostate cancer has caused over 60,000 deaths in the past 2 years. However, there are 2.5 million survivors across the United States. So what is prostate cancer? Prostate cancer is an abnormal growth of cells in the prostate glands. These abnormal growth of cells form tumors. Most malignant tumors develop in the peripheral zone or large outer area. Prostate cancer is slow growing and requires medical diagnosis. Who gets prostate cancer? Men of older age, men with a family history of prostate cancer, history of tobacco use, being overweight and or obese can cause prostate cancer. In 2021, there were almost 250,000 new cases of prostate cancer in the United States, and just over 34,000 deaths from prostate cancer. Black men are more likely to get prostate cancer and are twice as likely to die from it than any other group. Signs and symptoms for prostate cancer may vary. There may be pain in the hips, back, or chest, shortness of breath, fatigue, fast heartbeat, dizziness, pale skin from anemia, and discomfort in legs or feet. Many issues can arise with urination, including sudden urges, difficulty urinating, and weak urinary flow. Risk factors for prostate cancer include older age, family history, smoking, and obesity. 60% of new cases occur after the age of 65, Unfortunately, Black men, specifically African American and Caribbean men of African descent, are most affected and are twice as likely to die as any other ethnic group. Family history linked to prostate cancer or even other cancers are risk factors. Some of these risk factors are not modifiable, but others are. For example, obesity. Obesity puts you at twice the risk and causes aggressive prostate cancer. Another example is smoking. Smoking has a modest positive association with prostate cancer. These risks can be reduced with an active lifestyle and healthy diet. Now let's move on to prostate cancer diagnosis. There are different screening methods to determine the presence of prostate cancer. Doctors can perform physical exams and tests. During the DRE, or digital rectal exam, the doctor physically feels for lumps or nodules and assesses if the prostate is enlarged. Some tests for prostate cancer include prostate-specific antigen test, which checks for the PSA levels in your blood. Genetic tests, which look for gene mutations in the cells and can be done with a biopsy. Doctors also recommend imaging, such as an MRI or ultrasound. Prostate cancer screening guidelines vary. The Preventive Service Task Force guidelines encourages individuals between the ages of 55 to 69 years to make individual decisions about the PSA test and to assess harms and benefits with healthcare providers. After 70 years of age, no routine is required. The American Urologist Association suggests continuing screening if predicted lifespan is greater than 10 to 15 years. The baseline PSA and DRA and screening every 2 years. Generally, 50-year-olds with 10 plus years ahead of them should begin conversations with their provider to make informed decisions. For Black men, begin talking to your provider at age 45. Higher risk individuals may have to begin having conversations at around 40. There are lifestyle changes that can be made to reduce the likelihood of prostate cancer. Do not smoke. Avoid tobacco at all costs. Maintain a healthy weight. This can be achieved through our next 2 points. Be physically active. Try to incorporate at least 30 minutes of exercise a day or 2.5 hours of moderate activity weekly. This can mean taking the stairs more frequently or going on walks. Have a healthy diet. This means more plants, less red meat. Try incorporating 2.5 fruits and vegetables into your daily diet. Before we move on to the next session, remember to email or call the Change team with any questions. Please feel free to take a 5-minute break if you feel necessary. Let's begin our discussion on breast cancer. Do you know someone who has or had breast cancer? Breast cancer is the most common cancer among women. Let's turn to page 11 of your manual to learn more about breast cancer. Breast cancer is quite common. About 1 in 8 women are diagnosed in their lifetime. Every 2 minutes, 1 woman is diagnosed with breast cancer in the United States. There is promise in beating breast cancer, as early detection and treatment has led to a 39% decline in deaths from breast cancer. Breast cancer currently has a survival rate of 89.7%. So what is breast cancer? Breast cancer is defined as abnormal cells or uncontrolled cell growth in the breast. What is the difference between invasive and non-invasive breast cancer? Invasive breast cancer is defined as cancer cells that have moved beyond their original point and have the potential to move to other parts of the body. Non-invasive breast cancer is defined as cancer cells that are contained to one area and have not spread. There are disparities with breast cancer. Black women are 2 times more likely to be diagnosed with late-stage breast cancer and are more likely to be diagnosed with an aggressive breast cancer. There's a bright side of things. There are around 3.5 million and counting breast cancer survivors in the United States. Now let's dive into a bit of breast anatomy. There are 3 main parts of the breast: lobules, ducts, and connective tissues. Lobules are glands that produce milk. Ducts are tubes that carry milk to the nipple. Most breast cancers begin in the ducts. Connective tissue is fibrous and fatty tissue that surrounds and holds everything together. The main function of breast is to produce milk. So what are some common forms of breast cancer? The most common types of breast cancer are invasive ductal carcinoma in situ, and invasive lobular carcinoma. How does breast cancer spread, and what is it called when cancer has spread? Breast cancer can spread outside the breast through blood vessels and lymph vessels. When cancer has spread, it has metastasized. Now let's dive deeper into the common forms of breast cancer and discuss invasive ductal carcinoma, IDC. Invasive means the cancer has spread to tissue beyond where it initially formed. IDC begins in the milk ducts and has the ability to metastasize. It is the most common type of invasive breast cancer, accounting for 80% of breast cancers. IDC is also the most common breast cancer in men. Now let's move on to ductal carcinoma in situ, DCIS. In situ describes when abnormal cells remain at original site of formation. There are 6 stages of breast cancer, 0 through 5. Stage 0 is non-invasive or pre-invasive cancer. Stages 1 through 5 are breast cancer. The last common type of breast cancer we will discuss is invasive lobular carcinoma, ILC. ILC is the second most common form of breast cancer. It begins in the milk-producing glands. ILC breaks through the wall of the lobule and invades surrounding breast tissue. ILC does not cause a firm or distinct lump. Thickening or swelling that feels different from surrounding area. Nipple is inverted. ILC can spread to lymph nodes and other areas of the body. It often involves both breasts. ILC tends to occur later in life. Breast cancer is not gender biased. It can also occur in men. It is 100 times less common than in women. There are disparities with men in breast cancer, as African American men have a higher incidence. Men diagnosed with breast cancer on average are 65 years old. It is often diagnosed at the later stages. There is about a 1.5-year gap between the first symptom and diagnosis. Do you have an idea what breast cancer can look or feel like? Breast cancer has many different appearances, including thick mass, indentation, skin erosion, redness or heat, new fluid, dimpling, bump, growing vein, retracted nipple, new shape or size, orange peel skin, or an invisible lump. Can you think of some things that you believe will help reduce the risk of breast cancer? A few suggested ways to reduce the risk of breast cancer include talking with your healthcare provider about risk. If you are taking hormone replacement therapy or oral contraceptives, avoid alcohol and heavy drinking, maintain a healthy weight, be physically active, encourage women to breastfeed for at least 1 year. Some other ways to reduce the risk of breast cancer include avoiding exposure to cancer-causing chemicals such as arsenic, asbestos, formaldehyde, nickel, or radon. Talk with your healthcare provider about limiting your radiation exposure. X-rays, medical or dental, CT or CAT scans, PET scans. Do you know the preferred age to begin annual breast cancer screening or mammograms? Annual mammograms are recommended to start between the ages of 40 to 44. Annual mammogram, in addition to a clinical breast exam, begins between the ages of 45 to 54. Every 2 years, mammogram or annual mammograms continue for the ages 55 plus. Remember that screening and early detection saves lives. If you have any questions on breast cancer, please contact the Change team via email or phone call. If you feel necessary, please take a 5-minute break before we begin with colorectal cancer. Do you know someone who has had colorectal cancer? You may know of the actor Chadwick Boseman, who died from colorectal cancer in 2019. This was a tragic loss, but it did help to raise awareness about colorectal cancer. Let's turn to page 20 in your manual and see if we can learn more about this form of cancer. There are currently more than 1 million colon cancer survivors in the United States. This is why we are so passionate about teaching you the importance of early screening and detection. It helps to make you a cancer survivor. Colon cancer is a cancer of the large intestines. Colorectal cancer is a cancer of the colon and the rectum. See both areas noted in the picture there. This type of cancer is slow growing and can take years to develop. Thankfully, it is a cancer that is preventable and treatable. Now, it's important that you know the symptoms of colorectal cancer to help detect it early enough to have a positive outcome. You may notice a change in your bowel habits. You may start to experience diarrhea or constipation. Look for blood in or on your stool. The blood may not be bright red blood you're used to seeing, but old blood, which looks like dark or black, like coffee grains. You may start to have bleeding from the rectum. More symptoms include frequent gas pains, cramps, bloating, and stomach aches. Other common symptoms can be unexplained weight loss and chronic fatigue. This picture on page 22 shows the 4 stages of colorectal cancer and how each invades the colon or rectum tissue. They are staged based on the size of the tumor, how far it has grown into the wall of the colon or rectum, if it has spread into surrounding lymph nodes or spread to distant sites. In the early stage, or stage 0, the cancer is well contained. It has not grown beyond the inner lining of the colon. Stage 1, the cancer has spread through the lining of the colon or rectum to the muscle layer. Stage 2 has 3 subcategories. In stage 2A, the cancer has grown into the outermost layers of the colon or rectum, but has not gone through them. In stage 2B, it has actually grown through the outermost layer. Stage 2C, it has spread through the layers in the colon or rectum and into nearby tissues or organs. Stage 3, the cancer has grown through the wall of the colon or rectum into lymph nodes. Stage 3 is also broken down into 2 subcategories, depending on the distance of the lymph nodes that the cancer spreads to. Finally, in stage 4, the cancer has spread to other distant organs. This stage is also separated into subcategories based on how distant the organs are. Like in the case of actor Chadwick Boseman, his has spread all the way to his brain, so he had stage 4C. When we look at risk factors for colorectal cancer, some are modifiable and some are non-modifiable, or things we can change versus things we can't change. Let's talk first about some of the risk factors you cannot change. These are non-modifiable risks. They include age. Risk for colorectal cancer can rise with age. Family history of colon or rectal cancer or polyps can be a risk factor. People with inflammatory bowel disease are at a higher risk. This is considered a non-modifiable risk because it can be a hereditary disease or a disease associated with an immune system malfunction. Personal history of colon, rectum, or ovary cancers are also considered non-modifiable risk. Modifiable risks for colorectal cancer are things you can change, like smoking. Smoking actually doubles your risk of colorectal cancer. Another modifiable risk includes being obese or overweight. Your food choices. Eating a lot of charred meats and processed meats is a risk factor, as well as drinking 3 or more alcoholic drinks a day. As you can see in the picture, our friend relaxing on the couch with his big bowl of popcorn and TV remote is increasing his risk by being inactive. Physical inactivity for extended time is also a modifiable risk factor. Now, if your mother had colon cancer, would that be a non-modifiable or modifiable risk for colorectal cancer? It would be a non-modifiable risk. What about if you never exercise and eat a charred grilled steak every night for dinner? Is that a non-modifiable risk or modifiable risk? That is a modifiable risk factor. Since inactivity is a risk factor, let's get up and stretch for a minute. On page 24, we're going to see some of the information on colorectal cancer screening. Remember, we said early detection and screening is vital for a positive outcome. The goal is to look for cancer before symptoms appear and to be able to find precancerous polyps and remove them. It is recommended by the American Cancer Society to start doing screenings at 45 years of age. Starting earlier, if there is a family history, a genetic disorder, or any of the other non-modifiable risks we just discussed. Then at regular intervals from ages 50 to 75. After 75, these individuals' decisions are determined by your doctor and could be based on your health and screening history. Really, it's best to have the conversation with your doctor now to see when is the best time for you to have a screening. There are several types of screening or tests your doctor or healthcare provider may recommend. They include stool tests, such as fecal blood tests, DNA tests, and immunochemical tests to detect blood in the GI tract. There are also medical procedures doctors do to look for polyps or abnormalities. Probably the most common is a colonoscopy. If you have specific questions about any of the tests or procedures, or maybe which is right for you, we recommend you speak with your healthcare provider. We talked about the fact that colorectal cancer affects Black adults more. We talked about what colorectal cancer is, the importance of early detection and screening, some modifiable and non-modifiable risk factors. Now let's talk about some of the different treatment options for fighting colorectal cancer. Just like treating other forms of cancers, doctors can treat colorectal cancer with surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, and hormone therapy. You can read and learn more about each with the information there on page 25. As we wrap up, we want you to know that you play an important role in increasing the knowledge, detection, and screening of colorectal cancer in the African American community. What will help is if you can remember these important facts and share them with others. Anything that increases your chances of getting a disease is a risk factor you should be aware of. So what are some modifiable risk factors that we talked about? Some modifiable risk factors we've mentioned are smoking, obesity, food choices, alcohol, and inactivity. The goal of screening is to look for cancer before symptoms appear. Please identify whether this is a true or false statement. If you have a family history, you should not screen for colorectal cancer before the age of 50. That is false. It is recommended for everyone to screen at age 50 and earlier if you have a family history, genetic disorders, or other factors. There are a lot of cancer treatment options available. Should you need any, your healthcare provider and medical team will discuss the best treatment option for you. The most important thing to remember is that early detection saves lives. If you have any questions or comments about the colorectal cancer material we covered, please contact the Change team via email or phone call. We hope that we have given you the knowledge and tools you need to put this information into practice in your life and in the life of your friends and family. Thank you so much for your time today. Next session, we will look at some of the risk factors for cancer. Until then, we hope you have a good day and we will see you next time.